Stronger muscles, stronger erections. A recent literature review explored the link between muscles and erections, and they discovered a positive association with muscle mass and muscle strength with erection quality. And this isn't just a one-off study, this is a literature review of 32 human studies that I want to unpack the methodology of in this video. We're going to look at how these studies were done, why this mechanism works, and then what you can do about it. And if you're new here, welcome to the channel. My name is Dr. Cody Crockett. I'm a DPT and executive health coach, and it's my mission to help men to unlock their full masculine potential. And in today's video, we're talking about two key aspects of that, being muscles and erections. So you're going to want to stick around for this video. And real quick, you can access my free resources, the Ultimate Guide to Semen Retention, free testosterone optimization course, and get information about my coaching in the link in the description below. I want to begin by looking at how this research review was conducted. And they screened from 355 studies, which narrowed it down to just 32 studies that were included. They looked at body composition, muscle strength, and erection quality. Now, when it comes to measuring body composition, many of these studies used the gold standard DEXA scan to measure. Some of the other studies used a bioelectrical impedance. So these studies were not all standardized in how they were done. They were all slightly different in how they used these measurements for body composition. And we're going to see that with strength as well. When it comes to measuring strength, many of these studies use hand grip strengths. And in PT world, we use something called a dynamometer. I have a dynamometer here, that's a digital dynamometer. And squeeze this and it gives you a number on the screen on how many kilograms or pounds that you're squeezing. There's also analog, which you would adjust the dial as well. Some studies, they looked at leg strength or also standing up, sitting down. But generally, most of these studies looked at DEXA scans and they looked at hand grip strength. Now, when it comes to measuring erection quality, these studies use something called the IIEF, and this is the International Index of Erectile Function. And this is a self-rating scale of 5 questions that the man self-rates himself on. So these are the primary methods on how these studies were conducted. This review analyzed those 32 studies, and this is where they extrapolated out this data. And what they found was that those men who have higher lean body mass are less likely to have erectile dysfunction. And they found that those men who have higher grip strength are less likely to experience erectile dysfunction. Now, what is the mechanism behind this? Why does this happen? That's what I want to explore next, beginning with looking at muscle mass. Somebody has increased lean body mass, increased muscle mass. That muscle is highly metabolic tissue. It soaks up glucose, blood sugar, just like a sponge. And if you have sugar, glucose, that's lingering around in your blood vessels, that sugar is causing inflammation, stress, and scarring in your tissues. Not just your tissues, your organs, but also the vessels. Having increased muscle mass is going to soak up that sugar, that glucose, and get it out of the bloodstream. Not only that, but having increased lean body mass is one of the best things that you can do for disease prevention. When it comes to cancers, when it comes to a variety of diseases, if you have increased body mass, increased lean mass specifically, that metabolic tissue is going to keep that stress off of your organs. So that's our first thing, is having increased muscle mass is going to increase your insulin sensitivity. And we can see that those people that have increased blood sugar, diabetes, they're insulin resistant, that sugar stays in their veins, in their arteries, and it just continues to circulate. So when they have increased blood sugar, that's causing damage to their vessels. It's making their tissues less receptive to glucose, and that causes their body to then have stress on the organs. This is one of the bigger issues for those men who have erectile dysfunction who are diabetic. Those things go hand in hand. So increasing your lean body mass, your muscle mass, is going to increase your insulin sensitivity. Next, we have less body fat equals less inflammation. If you have more body fat, that's causing more inflammation throughout the whole systems of your body. This also increases the amount of estrogen that your body has. The more fat you have, the more estrogen it's being produced in your body. So by having lower inflammation, you're going to take the stress off of your organs, off of your tissues, and you're going to find that that's going to increase your erection quality. And then we have the endothelium itself. And the endothelium, this is the vasculature of your arteries, of your veins. And that endothelium creates nitric oxide through the process of endothelial nitric oxide synthase. That synthase is released and that causes nitric oxide to increase. So by having healthy veins, arteries, tissues, this is going to increase the blood flow and this is going to increase your erection quality. So these are some of the mechanisms behind having increased muscle size, increased muscle strength, and how this is affecting erection quality. And then finally, we have training. So when you're training, you're exerting yourself, you're working the tissues, you're driving blood, nutrients to those tissues, it's reinforcing that pathway of driving fluid to that tissue. What that does is that sparks the process of angiogenesis, increasing capillary density, blood flow to that area. So by exercising, you're driving more blood flow to that area. When you exercise a muscle consistently, you're going to notice increased vessels developing around that area, increased blood flow, muscle pump. The same goes for your erection. When you're training your tissues, and it's not just your erectile tissue, but your body as a whole, it's going to increase the blood flow throughout your body. So now you know why this works and what this mechanism is, but what can you do about it? Well, this is what you can do about it. First thing is to do strength training and do that 3 times a week. When you're strength training, I want you to lift hard, heavy, focus on exertion, intensity, effort. It's through that effort, through that intensity, that you're going to activate your nervous system and cause this hormonal increase that's going to cause the result you're looking for. Too many men paddle around with doing lightweight, single joint exercises and don't actually get the results. So when it comes to strength training 3 times a week, focusing on around 80% of your 1 rep max and keeping the intensity up. Next up, you want to do your zone 2 cardio. And this you want to do 3 times a week for at least 20 minutes at a time. And this is going to increase blood flow throughout your whole body. This is going to increase your circulation, your heart health. And this is going to drive fluid and nutrients to your tissues. This isn't going to cannibalize your strength gains. This isn't going to ruin the work that you're putting in with your strength training. This is going to amplify and this is going to support your recovery from your strength gains. So guys, make sure that you're hitting your cardio 3 times a week minimum. Next, eating. You want to eat your protein foods. So focusing on your protein, around 1 gram per 1 pound of lean body mass. If you're 20% body fat or higher, you're going to want to use about 0.8 grams per pound of body mass. And that's because you don't want to account for feeding the excess fat that you have. And then you want to choose foods that are going to be focused on nitric oxide release. And these are foods such as watermelon, arugula, and I'm going to make a future video going into more depth on these foods, supplements that you can use to optimize nitric oxide and blood flow naturally. And then finally, you want to focus on getting to 10 to 12% body fat. It's in that 10 to 12% body fat range that your hormones are going to be optimal, that your testosterone is going to be the highest, that you're going to have lower body fat. And that's one of the best factors that you can do to increase your testosterone and your erection quality. The next thing you're going to want to do is to get down to 10 to 12% body fat. This is optimal for your hormones, for having higher testosterone levels, for having lower estrogen, to take the load off of having excess body fat and inflammation. So get yourself down to 10 to 12% body fat, and you're going to notice that makes you feel better, makes you look healthier, makes you look younger, and it's just one of the best things you can do for your health and your performance. And if you want to get the full framework on how to optimize your health, your performance, and unlock your masculine potential, you can now get access to Executive Eros. And this we just released to the public a couple days ago. It was exclusive to my email newsletter, and this includes all of my best protocols for doing a dopamine detox, for resetting your androgen receptors, optimizing testosterone, doing the pelvic floor exercises to contract and relax and breathe into your balls, semen retention. You can now access that at the link in the description below. Thank you for watching this video. Please hit the like button, comment, and subscribe, and I'll talk to you soon.